Alright, so before we began, we cut off the fibrous pericardium, and that is the coating that holds the heart and everything together. Then the next thing on here is this layer right here is the visceral pericardium. And in the visceral pericardium, we have the coronary blood vessels and we have the cardiac vessels. Then right here we have adipose tissue, which is just fat on the heart. Then in here we have the myocardium, and you can also see it out here. It's the darkish area, and it pumps the heart. Then we have the right auricle and the left auricle right here, and they kind of look like ears. We have the pulmonary trunk in here. This is the aorta. Then the ligamentum arteriosum is right in here, and that's for when you're a fetus and you're not breathing. It makes the blood skip going to your lungs. Then up here we have the superior vena cava, and down here we have the inferior vena cava. We have the pulmonary trunk, which is where the left and right pulmonary veins will come out of. Then we have the brachiocephalic, is that how you say it, artery? Yeah. Then back here we would have the coronary sinus. You can't really see it on here. Okay, then, okay, on the heart you have the apex region and then the base. And when we look on the inside, we can see the left atrium, the left ventricle, the right ventricle, and the right atrium. Right here we have the tricuspid valve. Right here we have the bicuspid valve. Then up here by the aorta we have the aortic semilunar valve. Then over here in the pulmonary trunk, we have the pulmonary semilunar valve. The endocardium is the tissue layer that's on the inside of the myocardium. The interventricular septum splits the left and right side of the heart, and it does that to separate oxygenated and deoxygenated blood. The papillary muscle is right here. The chordae tendineae are right here. And then the pulmonary trunk is right here. And here's the aorta. And that's the anatomy of a heart.